decided I was going to take Delaware off of the map, too, just because Joe Biden pisses me off, but that's a different story. By the way, okay, just saying, government wants me to inform you every day. Right-wing extreme. Actually a libertarian, but a right-wing extremist libertarian, one that believes in the Constitution. Tonight I want to talk to you about something that somebody said earlier to me today. You know, no, Glenn, don't you think you're kind of going into the loopy territory? No, I think the world is moving into the loopy territory. I'm just trying to explain what's happening. We look at everything happening in Washington, and it doesn't make sense, right? It's because we're using the same logic we're used to, the logic that we all grew up with. Tonight, I'm going to talk about green energy, healthcare, and best of all of these bills. But I'm going to do it in a new context. Here's the one thing tonight. Everything that is getting pushed through Congress, including this healthcare bill, are transforming America. And they are all driven by President Obama's thinking on one idea. Reparations. Oh, but you crazy right-wing extremist. Before you say anything, President Obama is against reparations. He himself said so. He said that, but what the media didn't report on, conveniently during the election, ignores the reason why he's against reparations. As I warned before the election, he doesn't think that reparations would go far enough. Quote, I fear that reparations would be an excuse for some to say we've paid our debt and to avoid the much harder work. You gotta be kidding me. So we can never pay the debt? The $360,000 in the Civil War, that wasn't enough? I had forgotten about this position on reparations until a couple of days ago. We were talking about some story on this program, and it was, I think it was about school or something, and it reminded me, and I was like, wait a minute. It ties everything together. Now let's just go back and find out. He said it doesn't pay the debt. Besides, we have to do much harder work. What is that harder work?
If we have a program, for example, of universal health care, that will disproportionately affect people of color because they're disproportionately uninsured. If we've got an agenda that says every child in America should be able to go to college regardless of income, that will disproportionately affect people of color because it's oftentimes our children who can't afford to go to college.
Okay, so he believes in the universal program because they disproportionately affect people of color. And that's the way he feels is the best way to right the wrongs of the past. These massive programs are Obama brand reparations, or in presidential speak, leveling out the playing field. But just in case the universalness of the programs doesn't somehow or another quench his reparation appetite, he's making sure to do his part to pay the debt in other areas. Written in the first 1,000-plus page bill that nobody's going to read before they vote on it is a provision in this healthcare bill that says a medical school or other health-related institution pursued a grant or other contract from the government, they would have to prove their inclusiveness to minorities. On page 881 and 882 of this bill, it states, quote, the Secretary of Health and Human Services shall give preference to those entities that have demonstrated a record of the following. 1. Training individuals who are underrepresented minority groups or disadvantaged backgrounds. 2. A high rate of placing graduates in practice settings having the principal focus of serving in underserved areas or populations experiencing health disparities. And 3, supporting teaching programs that address the healthcare needs of vulnerable populations. Vulnerable populations. Wow, this whole thing could have been written by Acorn, who, by the way, on a side note, CNS News reports today they might get cash earmarked for the health care bill for community-based organizations. When asked about it, Chris Dodd said, I don't know if Acorn's going to get the money or not. So, you got it? This isn't preference to the best institutions that are going to be turning out our doctors, but the institution with the most diversity. We shouldn't be dishing out grants based on what hospital looks, the most like an old Navy commercial. Also in this bill, the Office of Civil Rights and the Office of Minority Health Remember I said to you, what kind of health care bill has, what is that? Well, they're going to be maintaining, collecting, and presenting federal data on race and ethnicity to see if they can identify gaps. When Obama's economic team was dreaming up the stimulus package, his former advisor, Secretary of Labor Robert Reich, said, quote,
I am concerned, as I'm sure many of you are, that these jobs not simply go to high-skilled people who are already professionals or to white male construction workers. I have nothing against white male construction workers. I'm just saying that there are a lot of other people who have needs as well.
Yeah, let's not give them to the high skilled or people who have experience. Let's just, let's make this a job training program. Obama's new green czar, Van Jones, this is the guy who is a self-avowed communist, and he is in the Obama administration. He says in his book that has been out now for about 4 months, The Green Collar Economy, subtitle, How One Solution Can Fix Two Big Problems, that the best way to fight global warming and urban poverty is by creating millions of green jobs. This guy wasn't a radical, then was arrested, spent 6 months in jails, came out a communist, then he was a communist anarchist radical, and then he decided he found the eco movement and decided green is the new red. He then went and became a green expert. A percentage of these jobs, he says, should go to the disadvantaged and to the chronically unemployed. Well, why are they chronically unemployed? The green economy should not just be about reclaiming thrown away stuff. It should be about reclaiming thrown away communities. Obama is no dummy. He knows that you would never pass reparations. He knows you would never pass any of this stuff. This is all affirmative action. He also knows we can't afford health care. He knows we can't afford cap and trade and more stimulus bills. But see, that's assuming that he wants to take care of somebody's health. It's assuming that he wants unemployment numbers the way we all understand unemployment numbers. And it's that he wants to take care of the environment. But I don't think those are his goals. That's a nice bonus. His goal is creating a new America, a new model. A model that will settle old racial scores through new social justice. Here is Linda Chavez. She is the chairman for the Center for Equal Opportunity and a Fox News contributor. Linda, do I have this wrong? And where, if I do?
Well, I can't see anything wrong with what you said. I can say that we ought to give at least the Obama administration high marks for no longer lying about this. I mean, they used to say, we don't grant preference, we simply want equal opportunity. Well, now they're actually putting the word preference into some of the legislation.
Okay, so now let's look at some of these things. First of all, tell me what the Office of Civil Rights done. This has been around for all government agencies since the 1960s, right?
That's right. Well, they are supposed to enforce our civil rights laws, but as I read those civil rights laws, what they say is you're not supposed to take race into account. You're not supposed to be deciding who gets a job or who gets promoted, who gets into college based on the color of their skin. Unfortunately, when the Democrats are in, sometimes those Office for Civil Rights do something very different.
Sometimes.
And they're really about promoting quotas.
Okay. Now, there's also the Office of Minority Health. And they're going to collect data. What kind of data and what is that used for?
Well, there's been a movement, I would say, over the last decade or two to try to show that there is really disparate treatment in healthcare based on race. And that if you go into the office and you've got a cold or you've got some other ailment and you're white, you get treated one way, but if you go in and you're black or Latino, you get treated differently. And obviously what this department is going to do is to try to collect statistics to prove that and to try to prove that it's racial discrimination that accounts for the different outcomes for different racial groups.
So they'll then collect the data, then probably pass it on to the Office of Civil Rights to then, as we outlined last night, the news czar likes to use the word in his book, nudge the system into a more fair system of health care. Do I have this right?
Well, you have it right, except the way they define fairness is really trying to equal outcomes. And, you know, healthcare, a lot of it is about behavior. It's about what people do to themselves.
Well, here's what I was worried about, because the Office of